I once watched two faculty members run the exact same unfolding case study with two different groups of students. One group left knowing what happened to the patient, the other left knowing how to think about the next one. The case was identical, same patient, same findings, same outcome. What differed was what the faculty member did at three specific moments. Before the first data point was revealed, at the moment students had to commit to a judgment, and in the 15 minutes after the outcome was shown. Those three moments are where clinical judgment gets built or gets bypassed. And in most classrooms, it gets bypassed. Not from carelessness, but because no one ever showed faculty what to do there. Now, we've largely accepted that unfolding case studies beat static ones, and the research backs that up. When information arrives in sequence, the way it does at the bedside, students have to reason in real time instead of sorting pre-organized data. But the structure alone doesn't produce clinical judgment. A beautifully written unfolding case in the hands of a faculty member asking the wrong questions gives you the same result as a static one. Students move through it, confirm the right answers, and leave having practiced recognition, not reasoning. And that's the distinction that matters. Recognition asks, what is wrong with this patient? Reasoning asks, what does this combination of findings mean for this patient right now? And what do I do before I have certainty? The structure creates the conditions. The questions are what activate it. The three moments. The first is before any data is revealed. Most faculty skip it entirely and go straight to the case. But this is where the real work begins. Before students see a single vital sign, ask them, based only on the patient header, what's this patient's biggest risk right now? What's the earliest sign you'd watch for? And what would you do immediately if you saw it? This isn't a quiz, it's a pre-commitment. When students commit before the data arrives, their brains are primed to integrate what comes next, not just receive it. The student who named respiratory depression as the risk before seeing the picture will read that falling respiratory rate at 2300 completely different than the student who met it cold. The pre-brief isn't preparation for the case, it's the beginning of the reasoning. The second moment is the decision point, where you stop revealing information and make students act on what they have. And the question matters enormously. Not what should the nurse do? That's a performance question. It just retrieves a protocol. The real one is, based only on what you know right now, before the picture is complete, what is your clinical judgment and what specifically tells you that? Students commit out loud to a specific position with incomplete information. And that is exactly what real practice looks like. The discomfort of that moment isn't a problem to fix. It's the mechanism of learning. The third moment is the debrief. Most debriefs ask what happened and whether the actions were correct. Those are performance debriefs. They correct behavior, but they don't build reasoning. The question that changes everything is this: at what point in this patient's story did the rescue window open? And when did it close? That one question reframes failure to rescue not as an event, but as a process. It pushes students to find the earliest moment a prepared nurse could have acted, almost always earlier than they think. It makes the compensation phase visible. It names the upstream signal that was there, available, and missed. And it gives them something they can carry, not the right answer to this case, but a habit of mind they take to the next patient. So here's the takeaway. The unfolding case study is not the point. What you do with it is. The structure gets students to the bedside, but it's what you do before, during, and after that decides whether they leave knowing what happened to one patient or knowing how to think about the next one. In the next video, I'll show you exactly what those questions sound like at each moment and walk you through a specific scenario that makes the difference concrete. If this is the work you care about, come see what it looks like in practice at lifebeatsolutions.com. Let's build the nurses our patients need. Thanks for watching.